All right, today we're going to be doing the skill catheter care. And for this skill, we're going to need quite a little bit of supplies here. We're going to need 2 washcloths, one for washing, one for rinsing. You're going to need a hand towel or a towel to dry. Then you're going to need, I usually use a color towel to go as a barrier so I don't forget it. It kind of helps me to forget. So against those white sheets, it's not so close to the white sheets that I don't forget it. They're going to need a towel to provide privacy, and then I'm going to use a towel to serve as a barrier for my supplies. I'm going to need some gloves. I'll need some soap, and I need no sensitive skin soap or hypoallergenic soap, and then I'm going to need a basin for my water. Good morning, Ms. Hill. My name is Ms. Mosley, and today I'm going to be your CNA, and we're going to be performing catheter care on you. Is that okay? Okay. She tells me it's okay. I'm going to provide privacy. I'm going to apply my gloves, and then I'm going to secure my water. I've secured my water, and I've checked the temperature of the water to make sure it's at a safe temperature. This can be done while we're obtaining it from the sink. And then I'm going to get my client to verify the temperature of the water. Ms. Hill, can you tell me if this water is comfortable for you? Okay, it is. All right, and then I'm going to take and I am going to pull back my sheet about to her knees. And then I'm going to take and I'm going to apply a towel to use as a barrier because that way I won't wet her gown. We want to provide privacy for the patient as much as we possibly can. And then I'm going to take my colored towel and I'm going to place it up under her, up under the hips and the buttocks. The critical step on this skill is that we want to make sure that we perform the skill without tugging or pulling on the catheter, and we want to make sure that we're cleaning in the right direction. I'm going to wet my washcloth, and I'm going to apply soap. And then I'm going to I want to hold my washcloth in my hand where it's folded half in two, like a hot dog style of folding the washcloth. I'm going to then take and I'm going to make sure that I uncover so that I can expose the area of the catheter. And then I'm going to take and I'm going to grab the catheter. I'm going to hold it at the meatus or the opening of the urethra. I'm going to make sure that I am actually touching that urethra because I don't want to miss any area of the catheter, but I'm going to hold it because I don't want it to pull or tug. I'm going to take the washcloth and I'm going to wrap it around my catheter, and I am going to gently come down and I am going to wash the catheter, and I'm going to go down at least 4 inches using only one direction. I'm going to then take and I'm going to get my other washcloth, and I'm going to do the same procedure, and I am going to rinse the catheter. And then I'm going to take my hand towel and do the same procedure, and I am going to dry the catheter. I am then going to remove all of my linens. I am going to provide her with privacy and pull her gown back down, remove all of the other linens. I'm going to empty the water into the toilet. Going to rinse my basin, pour that water into the toilet, and then I will dry my basin. All the time I'm trying to be very careful and not to contaminate my uniform or my clothes with the linen that I have used. I'm going to place all of this linen into my basin. That helps me hold it away from my body. I'm going to take the dirty linen and I'm going to put it in the dirty supply or the linen container, and then I'm going to place the basin and my soap on the dirty supply table. Okay, I am going to remove my gloves without contaminating myself. I'm going to wash my hands. I'm going to ensure that the bed is in the lowest position. And I'm going to make sure that the call light is within her reach. And I am now done with my skill.